John Dickerson is with us now from Washington. He's our CBS News chief Washington correspondent and anchor of Face the Nation. John, always good to see you.
Thanks, DeMarco. Great to see you.
President Trump's budget director, Mick Mulvaney, told you we are all sort of guessing about the impact of the bill. Help us understand the calculation from House Republicans of supporting a measure without a final CBO score.
Well, I think they want to get the ball rolling. They didn't want to go home to their constituents without having passed the Affordable Care Act replacement, which they have promised they will do since 2010. So they figured basically get the win on passing something out of the House and take the hit for not having the numbers. There also seem to be some number of people, including Director Mulvaney and also House Speaker Paul Ryan, who seem to be expecting this bill to change quite a lot in the Senate. And so despite the fact that they were in the Rose Garden celebrating what's in this bill, there seems to certainly be the clear message that what's in this bill is not sufficient to pass simply by itself into law, that they want changes in the Senate. Now the question is, do the changes in the Senate survive once it gets back and has to be reconciled with the House?
So, John, what differences in approach are we seeing on this health care measure from the House Republicans versus Senate Republicans?
Two big differences. One, the senators are going to wait and get a review from an assessment and analysis from the nonpartisan Congressional Budget Office and get the kind of numbers and then base their analyses on those facts. Now, the Congressional Budget Office does not come down from upon high with perfect data, but it is at least somewhere to make your decisions, something to make your decisions based upon. So they're going to do that. And then there's going to be quite a lot of deliberation. There is a Senate working group of Republicans only, which gives you some sense of the way they're going to go forward. Republicans only, they're going to think through the issues here. The question of pre-existing conditions, the guaranteed health benefits, how to give flexibility to the states without losing the promises that people expect now because of the success of Obamacare in this specific areas. How to protect those protections, and then also the question of Medicaid recipients, people who might lose their coverage, the poorest and the near poor who are worried about changes.
It's interesting to note Democrats basically didn't touch the House version of the bill. What approach do you expect Senate Democrats to take on their chamber's version of health care?
Well, the Senate Democrats are really not part of the story in the Senate right now, at least as it seems to be designed by the majority leader. The threshold for passing this portion of health care reform, you only need 50 votes in the Senate. That, of course, wouldn't be true of a normal piece of legislation, but this is passing under reconciliation rules. So they don't need any Democrats, but getting agreement among Republicans is going to be tough enough. So I think Democrats will use this as an opportunity in the Senate to basically try to define the entire Republican Party by the details in the House bill, create inter-party tension among Republicans, and try to really create an indelible impression about the Republican Party based upon their worst characterization of the bill. It is in the interest of the Republican Party for the Republicans in the Senate to shave off the tough edges, ameliorate the bill in a way that allows Republicans to say something positive about it. So while the Senate is on a deliberate path, it is in their political interest to try to get something out there that allows Republicans to have more talking points.
All right, John, on the separate topic here, you asked Budget Director Mick Mulvaney about the president's tweet this week suggesting the government could use a good shutdown. Here's a clip of his response.
The spending process, Congress using the power of the purse, has been broken here in Washington for more than 10 years. And I think a good shutdown would be one that could help fix that. It's part of that overall drain the swamp mentality about Washington, D.C. This president is willing to think outside the box and do things differently around here in order to change Washington. And if that comes to a shutdown in September, so be it.
John, what audience was Mulvaney trying to reach there?
Well, I think it's an opening gambit. Basically, I think the audience is both Democrats and Republicans. To Republicans in the Senate, the idea is, don't think that there can be a lot of wheeling and dealing. It's in the Senate that, of course, they need to wheel and deal because those appropriations bills require 60 votes. You need 8 Democrats to get it done. So I think it's an opening gambit in these negotiations, but in the end, there are a lot of Republicans, including Republican leaders, who believe that if there is a shutdown, that the facts of the case never make it into the conversation, that voters will simply penalize the party that is in control. And in this case, it's Republicans in the Congress and Republicans in the White House. And so that a threat of a shutdown is not actually a real threat, because Republicans know that they, at least those in Congress, feel like they cannot have a government shutdown and survive it politically. So, you know, it's a pretty stark thing for the president to say and for his OMB director to back up. But it shows that basically the negotiations over the next budget, which will start soon enough, are going to be pretty tough.
All right, John Dickerson in Washington. John, always good to see you. Thank you.
Thank you, DeMarco.